Canes are strongly recommended for overall management of people with knee or hip osteoarthritis. The main reason is that it's able to offload some of the damaging joint stresses that occur as we do our regular walking and activities. And so in using the walking stick, it can actually lead to reductions in pain, and also it can allow people to do their daily activities a little bit easier. So this is a walking stick, or sometimes referred to as walking cane. It's used quite frequently for people with joint disease such as osteoarthritis to offload some of their body weight through it as they take a step. So the cane can be used in various different ways. It can be used as recreational equipment, basically, so people can use the walking stick only when they're doing their regular daily walks around the parks and so on. It can also be used constantly, so within the house and also outside of the house. It really depends on why somebody needs to use a walking stick as to how they're going to use it. If people are trying to use it to reduce the joint stresses in their knees or hips, it's probably best for them to use it during their recreational activities. But if they need to use it for balance, to improve their balance, they can use it on a more regular basis. There are several types of walking sticks or canes. The most common is a single point stick, or a single point walking stick, just like the one that we showed before. There's also a 4-point stick available. They are not used that commonly. And there are also different types of walking aids that people can use. So things like hiking poles. There are a lot of proven benefits to using a walking cane. Unfortunately, they don't seem to be the same effects as using a hiking pole. So hiking poles have recently become a lot more popular because of their sporting nature. Unfortunately, the load-reducing effects haven't been proven with hiking poles, and they can actually increase the forces in people with knee osteoarthritis. So I would just be a little bit cautious if I was to choose hiking poles if I had knee osteoarthritis. There are some people for whom a walking stick might not be appropriate, and those are predominantly people who might have troubles or some sort of injuries to their upper limbs, so their arms or their hands or their elbows, and they might not be able to place appropriate weight through the handle. People who also have trouble coordinating the movement might have difficulty in achieving the same load-reducing benefits to the knees and hips and feet. And also people who have generalized widespread arthritis, such as rheumatoid arthritis, might have difficulty using the walking stick to offload. So for people with rheumatoid arthritis, they can also use this walking cane, but they might need to see an occupational therapist to get a specially designed handle so that they can actually place adequate forces through it. So using a walking cane will reduce the pain. It will improve your ability to do your daily tasks. It will improve the exercise that you can do and be able to do more. And most importantly, it can actually slow down the progression of osteoarthritis.